how well, and if they pass on the first time, and how well they do on their clinical rotations, right? Then they get into residency. But they have to pass the exams, the USMLE step 1, step 2, and then there's also a CS, step 2 CS. There's 3 exams. You pass them, you do good on them, you should get into residency, and you do good in your clinical rotations.
Actually, in case of USA, they are taking 4 years general course, then MD, and then go for this residency.
Yes.
So, is there any difference for that? Whatever the course provided by this university, it is a 2.5 years course, theoretical course, and then after 2 years.
Yeah, it's clinical rotations. So clinical practice, yeah, but it's supervised clinical practice in the USA at hospitals here. So that provides a lot of more experience, and if the student does well in the hospitals, whichever hospital they rotate at, and they have the marks, they might even get admitted residency in that hospital. But they will be doing residencies in an American hospital, right?
Yes.
Their clinical rotations.
Yeah, rotation will be according to this university. They are going to provide it in Michigan and another hospital.
Yes, yes. They have affiliations with many hospitals. So
my question is whether that 2.5 years course is enough, theoretical course is enough for this, or is there any?
So after 2.5 years, there's 2 years of practical course, right?
Yeah.
That's in the US. So during that practical course, you would also be doing theory too. You will be writing the United States medical licensing exams, the USMLEs. So when you're studying for that, that's theory also. But you're also going to be doing practical knowledge where you're learning alongside with your theory. During that time is when you write your exams. Okay. And that counts as theory, right? So just studying for those exams, it takes about 6 months to study for one of those exams, and you have to study hard. So that's a lot of theoretical knowledge that you're gaining. But and then you're going there and applying that theoretical knowledge at the hospital where you're doing your clinical practice as a student.
Okay.
Yeah. In short, yes, it is possible. After completion of MD degree from St. Martinus University, you can go for the residency. You can apply to various teaching hospitals, and once you get selected, you can start your residency, because these hospitals are ECFMG approved hospitals. Yes, please. Next question, please.
It's okay. From my side, it's. Thank you.
Thank you. Yeah.
All right. Anybody is having any other question, please?
Gupta madam, I think you can unmute yourself and ask your questions. Ranjana Gupta madam. Please unmute yourself. Sharma sir, if you have any question, Somesh Sharma sir, if you have any question, please go ahead and ask. You can ask in any language.
Okay. Mr. Bhatia, are you students of Martinus University?
I was a student of St. Martinus University, yes. Now I'm a resident at Pontiac General Hospital. Sorry?
Okay. And which batch, sir? Which batch? Which year's batch?
I'm in
which
the
year's batch?
The 2016 batch. That's when I started. So
okay,
I graduated. Okay. Yeah.
And how many stipend get you today?
How many? Sorry.
Sorry, sir is asking about your stipend. You are eligible for stipend during your PG program. So, sir want to know about your stipend which you are earning there during your residency program?
In my residency, yes, I get paid every 2 weeks. American dollars, about 1,500 American dollars. That's how much my stipend is. That's just general throughout all of residency. So every residency program, that's how much they get paid. It's the same throughout the United States.
Are you $65 at night?
Sorry, I can't. I'm sorry, you're cutting out.
Oh, are you now? Are you hear me?
Somesh sir, I think your network is not good, so your voice is breaking.
Okay.
शर्मा जी,
Okay,
आपका
sir, okay,
आवाज
okay.
नहीं आ रहा है। शर्मा जी,
हाँ जी।
आवाज नहीं आ रहा है आपका। नेट
अच्छा।
का कुछ प्रॉब्लम है
जी, अब आप सुन सक रहे हैं?
हाँ, बोलिए।
हाँ सर, मैं पूछना चाहता हूँ भाटिया जी से कि अभी वो स्टाइपेंड जो अर्न कर रहे हैं वो कितने रुपीस अर्न कर रहे हैं? उन्होंने 65 बोला, ऐसा मुझे कुछ तो सुने आया। $65 ऐसा बोला।
Oh, rupees come. I don't know how much rupees is, but dollars.
Dollars.
About,
dollars. How many dollars are you getting?
So it's about $3,000 per month.
Okay, sir. Okay. And sir, can you explain what is the effect of 18 November's decision of MCI?
Sorry, can you repeat the question?
On 18 November.
शर्मा सर, ये जो न्यू रूल हुआ है ना, इसके बारे में हम बाद में बात करेंगे। अभी स्टूडेंट के लिए आपके जो सवाल है वो पूछ लीजिएगा, बिकॉज ये काफी पुराने स्टूडेंट है, तो इनको इसके ऊपर कोई फर्क नहीं पड़ने वाला है। हम जो न्यू रूल है उसके बारे में हम बाद में बात करेंगे।
अपन आपस मिलके बात कर लेंगे, कोई दिक्कत नहीं।
हाँ, इफ यू हैव एनी क्वेश्चन फॉर पॉल सर, आप उनसे बात करिए। Subhash Barik sir is again having some question. Sir, पूछिए। Subrat Barik.
Yeah, hi.
Go ahead. If possible, if you can start your camera.
Just a second. Yeah, hi. First of all, good evening, and I don't know, good morning probably with Dr. Bhatia. So thanks, and it's good to have you in this forum now. It's not a question. It's like it's good to know your experience, and it's good to know that it will give the parents an idea that how many of your classmates were there with you, and how many how they have been settled in the US and other organizations. So it will give an idea to the parents that okay, what is the prospects of getting to this university.
For example, my batch was a small class. It was about I think 20 students. Everybody has residency, so everybody. I know 3 of them are doing internal medicine. They're all in different. One is in Pennsylvania. One is in Washington. That's in Seattle. I'm in Michigan. And then the females also. We all got residency. So my batch was very good. And then the next batch, they also did well. They're all getting to residencies. It all depends on how well you do on your exams, the USMLE exams.
Yeah, of course, the merit is always there, and it's good to know that. It's good to know that, okay, if you're saying that in your batch almost 20 students are there, and almost all of them are somehow able to do the residency, it's good to know. Okay, that's my question for the time being.
One more thing, we have Sarvesh as well with us. Sarvesh joined from Curaçao. So if you have any questions regarding Curaçao or maybe basic sciences program, you can ask to Sarvesh as well. Sarvesh, are you there?
Yes, sir. Good evening, sir.
Hi, good evening. Yes, Sarvesh is also there, and Dr. Bhatia is also there. So you can ask questions if you're having, please.
Sarvesh, if you want to share some experience of yours with us, like with all the parents, it will be good to hear from you.
Okay, good evening to everyone. I'm Sarvesh Londe. I have already completed my MD4 from St. Martinus University, and I'm now preparing for my USMLE, which I'll be giving in the next 3 to 4 months probably. And what should I say? What do you want me to talk about, basically?
Just they want to know about the program, about the facilities in the university, about the food, maize, safety in the Curaçao, all right? And teachers, cooperation of the teachers and all.
Right.
Okay,
so
right.
As we all already know that the program is based in 2 different phases, the clinical phase and the preclinical, which is the basic sciences phase, which I have already completed. In the first 2.5 years of my Curaçao life, like I was there for like 1.5 years before the COVID happened. And for the campus, I should say the campus is pretty nice, pretty comfortable, and it's pretty windy. So there's no problem with living on the campus. It's pretty safe. You get Indian food, 2 meals a day, and that would be enough. You can prepare a 3rd meal if you want to. I just want to check that I'm audible to everyone because I have some internet issues in here. So
no, yes, you are audible. You're audible, yes, and
okay.
we can see you as well. No problem. Yes, you can.
Okay, great. Okay, great. So, like in the basic sciences program, we have 5 MD semesters, like MD1, MD0, MD1, MD2, MD3, MD4. And in that, we cover all the basic sciences, like all the theory part of medicine, including pathology, pharmacology, physiology, as Dr. Paul Bhatia has already mentioned. The clinical program, I haven't started yet, so I will not talk about it. I think Dr. Bhatia is the best person to talk about. What else should I talk? Is there anything you want me to talk about in particular?
No, thanks a lot. It's good to know the experience actually who are pursuing some courses there. It's good to know directly from them. Thanks, Sarvesh, and good luck for your USMLE. I have another another question probably. I read somehow and came to know from few of my colleagues that I came to know from few of my colleagues that there are 4 or 5 good universities which provides the degrees in medicines in the Caribbean, and there are some universities which normally pay a certain amount to the hospitals to get all these clinical rotations. So, but I didn't, when I was looking for it, I didn't find St. Martinus in that. I don't know what agreement you have with, like St. Martinus has with the Michigan Hospital or other hospitals. So it's how it works. So it's good to know that how it works. Like let's say 15 students, they're completing their basic science courses, then all the 15 will be going for this rotation, or there is a process through which they will be selected for this rotation, clinical rotations, how it works, or you have any agreement already with these hospitals that
Sir, sorry to interrupt you. actually see what happened. There are so many agreements with the hospital, but here we are talking about the own hospital. This is the only Caribbean university. They are having their hospitals in US. So in majority, there are two hospitals. One is Pontiac General Hospital in Michigan, and other one is Galesburg Cottage Hospital in Galesburg. All right. So these two hospitals are owned by the university. All right. So there is no question of the agreement, and all the students, those are studying in St. Martinus, if they crack USMLE step 1, definitely they will get opportunity to go to US and complete their clinical rotations from one of the hospital, or maybe few rotations from one hospital and few rotations from other hospital. All right. Any other questions, sir?
Excuse me, is that the student has to pass USMLE stage 1, then only they will go for this clinical rotation?
Yes, sir. They have to.
I see. So
Sir,
without
there is
USMLE stage 1, they cannot go for this clinical rotation.
Sir, sorry to interrupt. Students can go for rotations by, there is one more exam, NBME. They can appear for this exam. They should get minimum qualified marks in this exam. And without USMLE also, they can go for rotations. But what we insist, what we tell students or what we advise, they should start rotations after writing USMLE, because if you want to do post-graduation from USA, you need to crack USMLE. Without USMLE, you cannot go for a residency in USA.
Yeah.
I hope I clear your doubt, sir.
Yes, very much. Yes, sir. There is one route, like student need to score certain marks in NBME, which is equally tough as USMLE. So if students score that marks, then there is one route that student can go for the clinical rotation, but they cannot write USMLE after 1 year of the completion of clinical rotation. All right. So after 1 year only they can write after clinical rotations, completion of the clinical rotation. Because see, whenever student complete basic sciences and clinical rotation, they are getting degree from the St. Martinus University, that is MD degree. Once they pass out, after that, yes, they can, even if willing to, they can go for the USMLE step 1 either, or they can go for the next test in India.
So, yeah, so the exams, they're actually very hard exams, but our students have been passing them. And one of the things is if you don't do the exams and then you go to the hospital and you don't know anything, the doctors get really mad. so that's the doctors get really angry if the student doesn't know anything. He doesn't, so the exam is, yes, they're very tough exams. But the thing is, like, you write them, you pass them, and then your knowledge base is really high. And then after you can actually talk to the attending doctors. They have an understanding of, some stuff. You can go see a patient. If you haven't written the exams and then you go to the clinical rotations, your knowledge base is going to be less too. And then also, and the doctors, like, they expect you to know a certain amount of information when you're in there, when you're going in to talk to the patients also. Yeah.
All right. Thank you, Dr. Bhatia. Any other question, please?
Is there any percentage if all the students are passing in your university, or is there any percentage of students, those who have failed to crack this USMLE or the other exam?
So I know, so they talked about 2 exams, which is the NBME. The NBME is a practice exam. So but you have to pass it, and then you will write the USMLE step exam. Because we don't want anybody failing the USMLE exam. So that's why, because that looks on your...
Sir, till today, all the candidates have passed this USMLE and this the other exam?
Yes, you cannot do any postgraduate residency without passing the USMLE exams. So every student who's in residency right now, who's a resident doctor right now, he's passed all his exams. And the university also, you have to pass the NBME, which is a practice exam, and you can write it as many times as you need to, or I believe it's like 4 or 5 times. You have 4 or 5 chances, and you have to meet a certain mark. And once you meet that mark, you can start your clinical rotations, and you're eligible to take your USMLE exam. And then on that NBME exam, that you have multiple opportunities to pass or write or to reach that mark. If you pass that exam, you will pass your USMLE exam.
Okay, thank you.
Yeah.
Any other question, please?
Yeah, if I can comment,
Sir,
Sorry.
sir, what is the medical college ranking as well as Michigan?
The medical college, it's Pontiac General Hospital. That's the hospital where we're associated with. That's where my residency is.
Hello. Yeah, Ranjana madam. Yes. Actually,
Sorry, sir, I want to ask, what is the medical college ranking in Michigan as well as Curaçao?
yeah. See, this is the St. Martinus University, and they're having only UG program. That too only basic sciences in Curaçao, and then students are going for the clinical rotation in Pontiac General Hospital. As far as ranking of the university is concerned, it's totally depends on the publications and researches those are happening in the university. So there is no question of the research and publication as the degree is UG degree. All right. So we cannot consider the ranking of the colleges and ranking of the UG medical university. Okay. It depends on totally research and publications. So research and publication is not part of the UG degree. Got, madam? Ranjana madam. Hello.
Okay, sir, got it.
All right. Any other question, please?
Yeah, it's me again. Thanks, Dr. Bhatia. It was nice talking to you and to get all this information. We are just talking about going to doing residency in the US and all. What are the other prospectus we have if we are completing this from St. Martinus University, this MD, to go to other countries like UK, Canada, other countries like so what we have?
So I'm originally Canadian. I'm from Canada, but the thing is, Canada's very much more tough than USA to get residency. USA is a lot easier. So I've just decided I'm going to settle down in America. But I know there's Canada. Like I think one student from St. Martinus got into Canada. She was very bright. She was very smart. And like, you know, she worked very hard. But Canada is very, very, very tough to get into residency. That's only because they have less hospitals. They have less medical schools, right? That's one of the reasons. So there's not enough positions there, and you're competing with a lot of other people for those positions. Whereas in America, there's a lot more hospitals, a lot more opportunities available for residency. I know that with the university, they can, it's Canada, USA, and England too, and India too. So those are 4 different countries people have options so far. I'm not sure. Please correct me if there's anything else.
No, yes, that's true. We do have students, those are like say very bright student. They can go to Canada, they can go to even US. We have a student in UK as well. All right, they are doing residency. So I think Pandey sir is having details already. I shared with him. He can share with you. But getting hospital is not a joke. Getting hospital in Canada, getting hospital in UK, getting hospital in US is not a joke. All right. So if you are getting hospital, that is a very good opportunity. And there is like say what we can say by the blessing of the Sharma family, yes, we have hospital in USA. So 2 hospitals are available for our students, and in the very low cost, students are eligible to go to US and complete their clinical rotation. If somebody is willing to go to other hospital or other country, yes, they are free to go. They need to try for that. Yes, we do have tie-up in Canadian hospital and US UK hospitals as well. But getting hospital is not that easy, even in US.
No, that's well understood. That's understood. The thing is, when we are saying, are these, I saw it in your website also, that it is recognized by the course or degree what we are receiving from St. Martinus. It is recognized by WHO and all. That's good to know. And these students, what my question was, these students, are they recognized like in these hospitals in other countries? That was my question. So as you are pointing out that there are you have tie-up. I don't know what, if you can tell us more on that. Like you said clearly that these 2 hospitals are your university hospitals, so where it is easier and it is must. Okay, and the other countries, they tie up. If you can provide some more information on that, even if now, or you can share them with us through email or.
No, so tie-up is like the agreement between the hospitals and university just for the mobility of the students. All right. Mobility of the student means one student complete their 2.5 years program, so they are eligible to go for the clinical rotations. All right. So that is the agreement, and it is not priority for that hospital which is located in Canada or UK. All right. If student is really bright, then definitely CREAM is always accepted. All right. Otherwise, we do have our hospitals in US. Student can go and complete their clinical rotations in US hospitals.
Thank you. Thanks for this information.
Thank you very much. So I hope Dr. Paul, yes, I think you very well, you have put light on all the, like say, whatever questions we had, whatever queries the parents had. So thank you very much for attending this meeting, coming on this platform on the invitation. Thanks a lot. We'll trouble you again. All right. I know your schedule is very busy. So if you have any work, you can leave the meeting. There is no any problem.
Sir,
yes,
sir,
thank you.
Paul sir, I think we have one more question for you. Subhash Barik sir wants to ask you something. Okay. Sir, please go ahead.
I want to know whether this in your hospitals student can go for this residency.
Pontiac General Hospital. A student. Well, I'm a student of St. Martinus University, and I'm doing my residency at Pontiac General Hospital. So yes, yeah. And there's another student. There's 2 other students that are from St. Martinus University that are doing residency in this hospital. We have 2 residency programs: family medicine and psychiatry, and I think they're expanding also. So yeah, so a total of right now in our psychiatry and family medicine residency programs, we have a total of 3 St. Martinus students, and then some American students, and then some students from other Caribbean universities. But we have 3 St. Martinus students. Yes.
Okay, in the university, the hospital in Michigan, and the other hospital, whatever is owned by this university, the candidates can go for residency in those universities or not?
Yes, yes. So I'm there in Pontiac General Hospital, and there's
You are
two
doing
other students.
residency from that hospital only.
Sorry?
You are doing residency from that hospital only?
Yes, yes.
Okay.
Yes, I'm doing residency at that Pontiac General Hospital, the hospital that my school owns. Yes. And then there's also two other students. So one in psychiatry, then one also my batchmate who's also from St. Martinus. So a total of 3 students. And these, it all depends on if there are attending doctors like you, right? And how well of a student you were during your clinical rotations. Because they're the ones that pick our main doctors.
Is there any particular number of seats available every year in the hospital for this residential program?
Yes, so I believe there's only 6 seats for family medicine and 6 seats for psychiatry. They might add more, there might be changes, but right now it's just 6.
Okay, only residency only in 2 subjects.
Yes, family medicine and psychiatry. And I believe they're expanding though. So in the next couple of years, I believe they're adding 1 or 2 more. I'm not sure,
Okay,
but they are.
Thank you, thank you.
Yes.
Anybody is having any other question, please? Okay, I hope all the questions are answered very well. Thank you, Dr. Bhatia.
Sir.
Yeah. Yes.
I have a question, sir.
Yeah. Please continue.
Sir, as you said, after doing MB/ME exam, we can go to clinical rotations, right?
Yes, USMLE step 1. There's step 1, step 2, and then there's 2 parts of step 2. So yes, after that, after you write USMLE step 1, you can go to your clinical rotations. After you write all the other exams, you can go to residency.
See, sir, now I have a question. If not USMLE 1, we will do MB/ME exam.
Yes,
after that, we can go to clinical rotation.
I believe so, yes.
After that, we don't get chance to write USMLE 3, no, sir.
No, you have to pass USMLE step.
My doubt is after completing clinical rotation, we again we can write USMLE step 2, sir. After clinical rotation, sir. After preparing.
Yes.
After MB/ME exam, we will do clinical rotation.
Yes.
Again, we can write USMLE 2, sir.
You have to pass USMLE step 1 to write step 2.
Yeah. Step 1, that only, sir. After clinical rotation, can I do step 1 again, sir?
If you after clinical rotation.
What I'm saying, sir.
You can pass it any time. It depends on the school. Depends on their policies right now. But I think they want you to pass at least the NBME once, and during your clinical rotations, you can study for your exams and get them done. But I believe they want you to pass at least one exam before you start clinical rotations.
Yeah. But after, if we don't crack USMLE step 1 at first attempt, we will try for MB/ME exam. After clinical rotation, we can write USMLE 1, sir. That is my question.
Yes. Ideally, that's why the NBME exam is there. We need you to get I think it's like 74%. That's the required mark, or it might be. I think it might be 76% now that they want you on the NBME. If you get that 76%, you will pass the USMLE step 1 on your first try. Hopefully, unless something goes really wrong. But on that NBME exam, you get your 76%. You have, I think, 4 or 5 tries to get that 76%, and then if you achieve that, you will pass your USMLE exam. You can just go write it a month or 2 later. So yeah.
Yes, sir. Thank you, sir.
Yeah.
I got it.
Yeah. Okay. Any more questions?
Yeah, I think, yes. Yes, do you have any question, please? Otherwise, I will ask Dr. Bhatia and Sarvesh to leave the meeting, and then we'll continue and we'll talk about the next gazette, like say, which is published on 18th of November. Anybody is having any question for Dr. Bhatia and Sarvesh? I hope questions are finished, and thank you very much once again, Dr. Bhatia, for joining us, and Sarvesh, thank you very much for joining us. Thanks a lot. Thanks.
Thank you.
Bye-bye. Take care. Bye-bye. Bye.
Bye.
Thanks. Also, thank you.
Thank you.
Yeah. So, yes. Now, yes, we'll talk about the gazette, and whatever queries, general queries you're having, you can ask me the question. So we'll talk about it. Any question? Hello.
Can I
Hello?
know? Can I know for how many years you are having this accreditation from the specified organization for this continuing this clinical rotation?
PCFMG accreditation is approved till 2024.
24.
Yeah. After that, we'll get extension.
Yeah. Actually, the students, those who are going to join this year, I mean next year, they will go for clinical rotation after 24.
Yes. Yes, definitely.
Yeah.
Yeah. So definitely we'll get for another 4 years. That is not an issue.
Okay.
And because of the pandemic, they are thinking to give the extension for 2 years more. So it might be increased by 2026. All right. So accreditation is not an issue. We have all the facilities, whatever are required to get accreditation. So accreditation is not an issue for us. And every university is having accreditation for limited period. And after that, we need to extend that. So definitely we are very much sure. In past also we got extension, and now in future also we'll get extension. And you know the result of the university is very good.
Yeah.
Now, any other question, please?
Hello?
Yes, please.
Hello, sir. I have heard about that people go to China and Russia for medical, for completing their medical degree, and I've heard, not heard any good about the China and Russia degree. Sir, what is about this USA degree?
USA degree is popular worldwide. It's like acceptable if student is really studious. If student clears step 1, step 2, and step 3, students are getting a registered physician status in USA. And if you are getting registered physician status in USA, you are acceptable worldwide. Student can practice in US, student can practice in UK, Canada, Holland, Australia, New Zealand. Yes, all the countries are open for the student. So this is one of the most valuable degree, and globally, the person will recognize as a doctor.
So, sir, will the students be needed to give any exams for separate countries?
Madam, if student complete USMLE step 1, step 2, step 3 from USA and get a status of registered physician, then they are exempted from all the country-wise exams.
Even for India?
Yes.
Okay, sir. Thank you.
Welcome.
हाँ दाद सर जी.
Yes, ma'am. Yes, sir.
हाँ सर. हेलो.
जी सर.
आप सुन पा रहे हैं मुझे?
बिल्कुल बिल्कुल, आप बताइए.
हाँ जी. जी सर, ये जो अपना 18 नंबर के गैजेट में गवर्नमेंट ने जो रूल बनाया है, कि कोई भी पर्सन 2 कंट्री के अंदर अपनी MBBS की पढ़ाई कंप्लीट नहीं कर सकता। उसको एक ही कंट्री में क्लिनिकल प्रैक्टिस और बेसिक साइंसेस कंप्लीट करना है। ठीक है ना? और साथ ही में हाँ, उसको इंटर्नशिप भी 1 साल की वहाँ कंप्लीट करना है। तो इस टर्म्स के अंदर में सर हम अपनी जो यूनिवर्सिटी है कोरासाओ की, ये कैसे सर उसको ये करती है पोजीशन को?
जी सर, देखिए ये जो गैजेट है, गैजेट अगर आपके पास है तो इसमें आप पहले नोटिफिकेशन में 5 नंबर का एक क्लॉज है, एप्लीकेबिलिटी ऑफ द रेगुलेशंस, और इसमें जो सी है 5th में सी, उसमें लिखा है कि कुछ सच फॉरेन मेडिकल ग्रेजुएट्स who are specifically exempted by the commission or the central government, as the case may be by notification. So the US practitioner, like say if the student is completing USMLE, they are exempted from this rule.
Okay.
Yeah. So you can check the part C of notification number 5.
ओके ठीक है ना। और सर दूसरी एक बात ऐसी कि एक ऐसी भी चर्चा कान पर आ रही है कि जैसे नेक्स्ट 1 एग्जाम हो रही है MBBS के स्टूडेंट्स के लिए, तो उसी तरह MD के बच्चों के लिए भी नेक्स्ट 2 लेवल की एक एग्जाम क्रिएट करने की कोशिश हो रही है।
अब सर देखिए, नेक्स्ट एग्जाम जो है वो अभी मैंडेटरी हो जाएगी। Whoever is willing to get registration in India, उनको ये एग्जाम, नेक्स्ट जो एग्जाम है वो मैंडेटरी कर दी गई है, इवन इंडियन बच्चों के लिए भी। लेकिन यहाँ पे जो क्लॉज जो पहले से एग्जेम्प्टेड है, उससे वो एग्जाम से जो पहले से एग्जेम्प्टेड है, तो वो है यूके में जो बच्चे पास होते हैं रजिस्टर्ड फिजिशियन है, जो यूएस में रजिस्टर्ड फिजिशियन है, और राइट जो ऑस्ट्रेलिया में है और न्यूजीलैंड में और कनाडा में है, इनके लिए ये एग्जेम्पशन रहेगा। ठीक है, क्योंकि नहीं तो क्या होगा सर, अगर हमारे यहाँ पे कोई डॉक्टर की जरूरत है, हम लोग अमेरिका से डॉक्टर बुलाते हैं, है ना। अमेरिका का डॉक्टर यहाँ पे जब तक रजिस्ट्रेशन नहीं है वो प्रैक्टिस नहीं कर पाएगा, तो तभी क्या हम उसको बोलेंगे भाई पहले नेक्स्ट दे दो फिर ऑपरेशन करो। बराबर है। तो ये जो है ये एग्जेम्प्टेड है। हाँ, ये अमेरिका के जो डॉक्टर्स हैं, जो रजिस्टर्ड फिजिशियन है, दे आर एग्जेम्प्टेड फ्रॉम दिस, इसमें क्लियरली मेंशन किया है जी।
यानी USMLE 2 कंप्लीट किया हुआ व्यक्ति इंडिया में आकर के भी अपनी प्रैक्टिस कर सकेगा।
2 नहीं सर,
कोई डाउट नहीं इसमें।
2 नहीं सर, 3 USMLE 2 नहीं, USMLE 3 आफ्टर रेसिडेंसी। हाँ, क्योंकि अमेरिका में बैचलर डिग्री के बाद आप डॉक्टर नहीं बनते हो, आपको मास्टर्स करना है, आपको रेसिडेंसी करना है। तो स्पेशलाइजेशन करने के बाद आपको USMLE स्टेप 3 देनी है, और उसके बाद आपको स्टेटस मिलता है रजिस्टर्ड फिजिशियन इन दैट कंट्री। मतलब यूएस में अगर आप यूएस के रजिस्टर्ड फिजिशियन हो तो देन यू आर अलाउड टू प्रैक्टिस।
ओके सर,
देना जरूरी है।
थैंक यू।
ऑलराइट, वेलकम सर।
ओके, ठीक है। ओके, ये क्यूरी थी मेरी। ओके, थैंक यू।
ओके सर, थैंक्स। एनी अदर क्वेश्चन? और किसी को कुछ पूछना है?
प्रशांत साळवे जी, साळवे सर, इफ यू हैव एनी क्वेश्चन पूछिए सर।
हाँ सर, मैं ये जानना चाहता हूँ कि पिछले 3 सालों में पूरा स्टेप 3 होने के बाद में कितना लोग क्वालिफाई हुए और कितना लोग डिस्क्वालिफाई हुए, कितने डॉक्टर्स? डिस्क्वालिफाई कोई भी नहीं हुआ है सर। अच्छा। हाँ, 100% हम रिजल्ट बोलते हैं तो सारे के सारे क्वालिफाई हो चुके हैं। कुछ बच्चे ऐसे हैं कि जिन्होंने USMLE नहीं दी है, वो इंडिया में आके उन्होंने नेक्स्ट की एग्जाम दी है, उसका भी रिजल्ट हमारे पास है। लास्ट टाइम हमारे 7 बच्चों ने नेक्स्ट का एग्जाम दिया था, ये FMG दिया था, फॉरेन मेडिकल ग्रेजुएट टेस्ट, तो उसमें भी 100% रिजल्ट है। उसका रिजल्ट मेरे ख्याल से पांडे सर के पास है भी, वो भी आपको भेज देंगे, उनके नाम वगैरह सब कुछ है। ओके, थैंक यू सर। वेलकम सर, वेलकम। Any other question, please?
Tanjit sir, if you have any question, please go ahead.
Sir, I'm playing the role of a good listener today. So I do not have any question, but it is a great learning session for me. Thank you, Dahat sir. I'm very keen and active now. You might have seen my YouTube videos also.
Yes, sir.
So I'm very vehemently and actively promoting SMU. And let us hope how well it goes.
Yeah, definitely.
Thank
And
you so
there
much.
is a 100% transparency, sir. We are not hiding anything.
Yes, that's the beauty of it, sir. And that's something I like.
Yes. Correct.
Thank you.
थैंक यू सर, थैंक यू।
Thank you.
गुप्ता मैडम कुछ है तो आप पूछ सकते हैं। मृणाल दामोदे। गुप्ता मैडम पूछिए, आपका सवाल पूछिए। अनम्यूट योरसेल्फ एंड आस्क।
हाँ सर। सर कुछ समय पहले ये न्यूज आई थी कि जैसे अभी पेंडेमिक जब चल रहा था तो उसमें रेसिकल बेसिस पे मतलब जैसे अपना जो अफ्रीकन ओरिजिन के है या इंडियन ओरिजिन के हैं तो उनको ड्यूटी में पहले लगाया गया था, उसके बाद अमेरिकन को मतलब बाकी जो व्हाइट है उनको ये किया गया था, तो ऐसा कुछ है क्या सर उधर?
मैंने तो कुछ ऐसा सुना नहीं, ऐसा कुछ है नहीं। और अगर ऐसा होता है कि पहले अफ्रीकन को और इंडियन को पहले काम पे लगाया जाता है तो दैट इज गुड साइन। दे आर गिविंग अपॉर्चुनिटी टू अस, या दैट इज गुड। दे आर नॉट कीपिंग अस बिहाइंड, हमें पहली प्रायोरिटी दे रहे हैं, सो दैट इज गुड। प्राउड, वी शुड फील प्राउड फॉर दैट। हम ऐसा कुछ क्यों सोचते हैं कि भाई हमें प्रायोरिटी, अगर हमें पीछे रखेंगे कि बोलेंगे नहीं पहले अमेरिकन ही करो, तो हम ये बोलेंगे कि यार हमें तो चांस ही नहीं दे रहे पढ़ने का, अमेरिकन को ही आगे घुसा रहे हैं। Am I right? हेलो।
हाँ सर।
जी मैडम।
सर वो तो हाँ सर वो तो मतलब रेसिकल बेसिस इज नॉट राइट ना?
नो मैम, ऐसा कुछ नहीं है, ऐसा कुछ नहीं है। देयर इज नो रेसिज्म, ऑलराइट। So they are giving opportunity. They might think that yes, these people are really clever, and that's the reason they are giving chance to Asians.
गुप्ता मैडम एक ही बात कहूंगा, जो भी टॉप कंपनीज है यूएस में सभी सीईओज ऑलमोस्ट इंडियंस है। दे आर लीडिंग पूरा यूएस अभी इंडिया चला रहा है। कहाँ है रेसिज्म? ये सब कुछ लोग कुछ भी बोलते हैं, आप इसमें मत जाइए। फैक्ट्स देखिए, जितनी भी बड़ी कंपनीज है टॉप पोस्ट पे सब, अगर ऐसा कुछ होता तो जिनकी ये यूनिवर्सिटी है शर्मा जी, उनको अपॉर्चुनिटी नहीं मिलती। He has his own university and he is having hospitals in USA.
Right,
Yes.
right.
Yeah, Ranjana ma'am, I think yes, your query is clear. If not, then you can ask me again.
Okay, thank you, sir.
All right, welcome, ma'am. Yes, anything about this GR, this Gazette of 18th November?
Mrunal Damode, if you have question, please go ahead.
So I will brief about this, like say, Gazette said that the program duration should be minimum 54 months. So we do have 4.5 years program. So the duration is 54 months. And they are also saying that there should be a internship of 1 year, 12 months. Yes, we can have that 12 months internship in Curaçao. For the student, those are willing to come back to India after step 2 and practicing in India. So there is no any problem. But all the students, those are going to the USA, those are exempted from these rules. Second thing, I would like to clear that all the students, those have taken admission before 18th of November 21 or they pass out before 18th November 21. Those all students are exempted from all these new rules. Okay, so even the student who took admission maybe in the month of October or maybe 1st of November or 15th of November, all those students are exempted from this GR. So this GR, these rules are not applicable to the students. Okay, anything else, any clarity you need? And there is no problem for our students, those are studying at St. Martinus University or completing their clinical rotation. Also, there will not be any issue for the student, those will take admission this year, next year, and next year. There is no any problem. All right. So I hope I clear all the doubts and about Gazette as well. If you are having any other query, you can write me, you can ask Pandey sir. So definitely we'll put more light on that. You can also arrange one-to-one with us. So in one-to-one also you can ask the questions. So there is no any problem. Yes, I hope all the doubts are clear, and with the permission of all of you, Pandey sir, can I end this meeting?
Yes, sir. Thank you very much. Thank you very much for arranging this wonderful session.
All right. Thank you very much. Thanks to all of you. Thanks a lot.